I'm Sarah Hubball. I'm a cardiac nurse specialist working for the Cardiac Rehab Team. So cardiac rehabilitation is a treatment option to help people to understand about their heart condition in order for them to learn about what steps they need to take to look after their health condition in the longer term. It basically empowers them to become involved in future healthcare discussions so that they can make a decision about their healthcare.
I joined the service back in last year, right in the middle of the first lockdown, and which my colleagues stated it was quite a difficult time and a transition from face-to-face clinics and classes to a virtual class.
I'm quite new, so I had my interview I think at the end of March, beginning of April. I was fortunate enough to get the job, but I didn't start until July. So when I arrived, we were already up and running with the virtual classes. So I kind of hopped in with that. It was a new experience because even in university, we did the face-to-face exercise classes. So it was quite new, but I had two good colleagues that were able to support me, plus I had the nursing staff as well, so that was good too.
When we are all ready, we will then start with the warm-up. So a nice little gentle march on spot. Okay, so when you're ready, start to assess the space you decided to. Make sure you're not going to step on something or someone. You're going to take the arm and go backwards. Remember, we're making sure nothing's going above our head, so everything's shoulder height.
You're concentrating.
Yes, I can't read your internal monologue. So if you're saying yes, it's a little voice in your brain. I can't hear that.
I'm fine, Jay.
3.
Oh, Sharon.
I'm sorry, Sharon.
Back to that gentle march. Grab some water if you want to. 4. That's cheating otherwise, isn't it?
It is really, yes.
Mr. Malik, are you okay?
Give yourself a little bit of breathing rate. Right, let's slow it down. We're just going to go to heel raises now. Place the hands together and pretend you're giving Calvin a big hug. And in about 20 seconds, we'll start with the leg stretches. Reset. All right, grab some water and grab a seat for me. Well done, everyone.
We will see anybody who has had an acute heart event, so they might have had a heart attack or heart surgery, might have had angina, had stents put in, for example, and they're referred to us from our local hospitals across the borough, so King's, St Thomas's, as well as the local hospitals such as Queen Elizabeth Prue and Darrant Valley. But we also see people with heart failure, which not many services see people with heart failure because of the number of staff needed to do the exercise with them.
The class was up and running when I came, and Helga was at the forefront with the nurses team. They showed me the ropes because virtual class was quite daunting for somebody that hasn't done anything online beforehand, and it worked well, very well, and it's still running to this day. But now we run both virtual on virtual classes. We do one face-to-face home visits for the high risk individuals, and also we're now doing class environment too.
With the virtual classes, we can only accept really low risk patients, low risk in terms of the likelihood of them having an event during exercise. With that, we need to ensure that they're stable on the medication, they're adhering to the medication. We've been through a functional test, so we know that functionally they are quite good and they're able to do the exercise itself. And then when they're exercising at home, they always have somebody there, so in case something were to happen that they're there. In the morning before we even start exercise, it's the case of we make sure that they are wearing appropriate footwear, they've taken the medications because it's so early in the morning as well, and then through there we're able to go through.
The important thing to say is that cardiac exercise is really, really safe. And I think a lot of people worry about doing exercise, especially after their heart event. The number of incidents with people taken unwell during an exercise class is really low, and that's because we do a lot of risk assessments prior to them coming along to the class.
The live classes, it's a bit more easier because we're able to interact, and you're able to see when patients are maybe beginning to kind of fall off a little bit. So you're able to intervene quite quickly and either reduce the intensity at which they're exercising until their heart rate kind of recovers and they're feeling a bit better, and then we can able to take them back up. Okay. So usually just before they refer to us, they would have been on some kind of a walking program. So they would have started to begin to get used to some form of exercise. When they come to us, how we just like suppress their fears is just to sort of say that it's a slow build up. So we start off nice and gentle with the warm-up itself, and we take things through. And what this is individualized to you as an individual. So it's not the group, it's not who you're exercising with, it's you.
So we offer a education program, and that is mainly done at the moment via Microsoft Teams. It's a virtual program. So one of our nurses and exercise specialists, along with other members of the multidisciplinary team, we'll do a short education session with them, different session for about 8 weeks. So we have the dietitian talking about eating healthily with living with a heart condition. We have our clinical psychologist talking about coping mechanisms, also managing stress and what tips they can do. We've got our cardiac exercise specialists who talk about long-term maintenance for exercise as well. With the variety of patients, we have to make sure that the information we give them is tailor-made for them. So it's not a one-size-fits-all, especially when it comes to education, and that's why we do such a varied education kind of service. So it's not just based around heart disease. It covers heart surgery, heart failure, helps younger people as well.
So after they finish with our cardiac rehabilitation after the 8 weeks, they have an option of joining the phase 4 in the community. That phase 4 is run by exercise specialists. If they don't feel a gym environment's for them, or the group environments for them, they will continue doing their home exercise programs, walking program, or if they've done a little bit of exercise at home with myself, Helga or Jay, then they can introduce that for themselves going forward.
Physical activity is really important for heart patients. It does help prevent against future heart disease and helps strengthen the heart, especially when people have had heart surgery or they have heart failure. It helps to improve the heart muscle function. So we want them to be as physically active as they can. And when it's done with healthcare professionals like we have in our team, with our exercise specialists, our cardiac nurses, we can do it safely and keep it safe for the patients.
I do feel optimistic about the future. It's been a very difficult year for the cardiac rehabilitation team because we've had to change, but we have adapted and we have made great strides in doing virtual class, and going forward I feel it's a good team and we work together. So yes, I feel that we will strive, especially now going back to face-to-face, so we have a lot more to play with going forward.